Oh, everybody was wonderful. Very nice, very friendly, outgoing.
How are you this morning?
They care, and that's important when you go someplace. If you see that they actually are warm and caring, it puts you at ease.
At the time of the colonoscopy, we detected a small lesion, which turned out to be a small colon cancer. And by identifying this cancer in an early stage, we were able to offer effective treatment. She had surgery and cured her completely.
This is the ambulatory surgical center, and this is where our procedures are performed.
We feel that the ambulatory endoscopy center offers some advantages in the sense that it's very smooth, efficient, effective. Our patients are very comfortable.
A lot of patients are anxious about the colonoscopy itself, the procedure, and adding anxiety in terms of having to go to a large facility like a hospital, which requires parking in a parking lot, and lots of anxiety related to just getting there is minimized at our center and others like it because people can drive right up to it. It's a small center, it's intimate. The other component of it is that it's typically much less expensive to do it here versus in the hospital for the patient as well as their insurance carriers. These rooms back here are used mainly for endoscopy. So we do upper endoscopies where we evaluate the stomach with a camera, and we evaluate the colon with a camera. They're called ambulatory surgical centers. The ambulatory means that patients can walk in and walk out. It's a same-day service.
It was so easy. Didn't feel anything. They have a screen where you can watch it, what's going on. They knew I came in early enough, and that was very important. To get it when it was just a little speck.
When they're done, we'll send them over to the scheduling or the checkout area over there where they can set up their colonoscopies, endoscopies, CAT scans, lab work, etc.
We want to spend enough time with each patient to do a good job. I mean, quality is our priority. I think most of our patients are very happy and can see that we really try to make this a good place. And like I said, our number one goal is obviously patient satisfaction and making sure that they get what they need, doing a good job for them.
Gastroenterology Consultants has been out here about a little over 20 years. The office opened around 1986. Ambulatory surgical centers charge less and are paid less than hospital facilities. There are multiple reasons for that. Hospitals have much higher overhead than we do, so we are able to provide the same service at a cost benefit. One new aspect that we added to our practice about 5 years ago was our website, which is in evolution. We're always trying to improve it. One of the things we're trying to do is make it more interactive with patients, where we can address concerns through emails. That way, that's cost savings for them because they don't have to take time off work to come see the doctor, and it makes it easier for us because we're sure that we're providing good care to our patients. Several of our nurses have been with us for almost 15 years. I was trying to add up the number of years in the physician group, and I stopped when I reached 125 because it made me feel too old. But we have 4 or 5 doctors that have been in practice for almost 30 years.
From the waiting room all the way through the checkout process, it's thought about in for patient ease and comfort, and everything's marked in a way that patients can not get lost back here and know exactly where we want them to go.
One question I ask patients frequently is that, did everybody treat you okay up front? And universally the answer is yes. I would want this to be a good experience for a patient where they feel they get the best possible care that they can receive from a gastroenterologist and from our nurses and from our staff, leaving with a feeling of satisfaction and that they received the care that they expected they were going to get.
Our hope is that they have a very stress-free experience, that we greet them at the door with a smile, and that they leave with a smile on their face, that we provide them a high-quality experience that is hopefully as low cost as possible, and that everybody be colon cancer free. That is everybody's hope, I think.
I can enjoy my grandchildren. They're big, they're grown. Go to football games, basketball games, soccer games, go to church, do my Meals on Wheels, go to exercise classes, and travel. So I have a good life.